So it's my very great pleasure to introduce Martin Webber and Beth Casey, along with Freya Cox from Ripon Museums, who are going to talk about their evaluation today. Beth, would you like to share your slides, and I'll let you introduce the project and yourselves properly, and that makes sure then that I don't get any of the details wrong. So welcome. So we normally talk for about 20 minutes or so. I won't have a timer on, and then we'll take questions and have a discussion at the end. And people are welcome to post comments and questions in the chat during the talk, but otherwise we'll save them until the end. So thanks.
Fantastic. Well, thank you very much, and thank you for the invite. And I look forward to the discussion which follows our brief presentation. My name is Martin Webber. I'm making the presentation today with my colleague Beth. We're both researchers at the University of York. Freya is the person at the Ripon Museums who's providing the support that we're talking about. So she will no doubt have something to say later on in the discussion. So if you've got any questions about Ripon Museums in particular, then I'm sure that Freya can answer some of those a bit later on. But certainly this is all about engaging with staff and volunteers at the museums, which has changed the way in which we've conducted the research. So we've talked about in the title, de-researchifying. If we've coined a new phrase, it could just be simplifying research processes, but we wanted to make it just a little bit more complicated. De-researchifying is what we feel that we've done. Try to use methods in a more sensitive way. So we're going to talk about the methods that we've been using and just really indicate where we're up to with the project, which is ongoing for the next several months. Beth's going to lead us through the presentation. So if we can just move on to the next one, which is the outline of the topics that we're going to be covering over the next 20 minutes or so in terms of providing some of the background to the project. I'm going to hand over to Beth to talk really about what she's been doing in terms of the methods, the way in which the advisory group has informed what we've done, where we're up to, and some reflections on the way in which we've conducted the methods, and then I'll come back at the end with some concluding comments. So what we know is that volunteers make a real difference to communities in which they are living, the voluntary sector as well. People of many backgrounds do volunteering. Lots of people undertake voluntary work or voluntary activities without necessarily knowing that they are being a volunteer or doing volunteering. And organisations which use volunteers are often supporting volunteers in a number of different ways. Some of them more formally than others. Sometimes it's just an informal check-in, but sometimes it's much more formal. What we know from literature around supported employment, for example, is that it's very effective at helping people with long-term mental health problems such as psychosis find employment. What we know less about, though, is whether supporting people to volunteer helps them to achieve their own particular goals. That might be volunteering independently or other work, employment, education, and so on. Indeed, people volunteer for a whole number of different reasons. And undertaking evaluations in this field is really complicated because of the nature of the activity. So, for example, you can't necessarily randomize people to volunteering or not, because people could just go and do volunteering anyway, because it is something which people just go and do. That's for another discussion, but I think it does kind of feature in the nature of exactly what we're trying to do. So the focus is on the support that's provided to people who may have mental health problems or low mental well-being, for whom volunteering might be a bit of a challenge. And we've noticed in terms of confidence, stigma, lack of workplace experience, for example, may prevent people being able to access volunteering opportunities. Whereas if the organisation advertises and provides support for volunteers, then it opens the door to them. It reduces barriers and it enables them to come in the door. Now, this is much more common in settings where people are receiving health or social care, whereas in a museum or within other settings in the community where volunteers are present, these types of schemes are more rare. So we had the amazing opportunity to work with Ripon Museums to evaluate their supported volunteering programme. Okay, I think it's over to you now, Beth. Okay, I'll just go through the aims and then I'll hand over in terms of the methods. We had three straightforward aims to, first of all, explore how and why it works, and we are at the moment finishing off a manual or practice guidance to share with other people about what supported volunteering actually looks like, looking at good practice and so on. We're measuring outcomes, assessing costs and potential economic consequences of supported volunteering. So that's what we're doing. Beth's going to take us through what we've done so far. Thank you.
Yeah, so just to outline, first of all, some of the methods that we've used in order to understand the support that's provided at Ripon Museum. So we used a combination of interviews, a diary method, and observations of practice as well. So in terms of the interviews with the supported volunteers and staff, I think we've interviewed, spoke with 18 people in total, and that was equally split between volunteers and staff members. So we had conversations with volunteers who were receiving additional support to help them to volunteer, and also interviews with Ripon Museum staff member. And we included a staff member who's since left as well, so it was interesting to get her perspective. And Martin's talked about this phrase we're using, so de-researchifying the research methods. I'm going to go on to discuss in more detail later on in the presentation, but we paid like real attention to the language that we were using. So in particular, we responded to, the knowledge that some supported volunteers might have quite negative experiences of interviews, particularly if they were applying for jobs recently and for paid work, or generally just experiencing quite low confidence. So with advice within the study team and also within the advisory group, which I'll go on to discuss later, we tended to refer not to the interview as an interview, but as a conversation or a chat within documents that we gave to supported volunteers. So in terms of like the information booklets, and also during conversations with volunteers when explaining what the study was about as well. So we really took kind of a very sensitive approach, and there's a body of research which talks about kind of sensitive research, particularly in relation to researching people who may have accessed health and social care services. So it was really important that it came across in kind of a non-threatening and sensitive way as well. So yes, 18 people in total were interviewed or had chats with. And to structure, it was a semi-structured conversation, and we had a topic guide, and that explored questions on how support is provided, how it was received, and really trying to unpick how and why support works at Ripon Museum as well. And we started off the conversations in particular with the volunteers to build up support rapport. So, we asked general questions about, perhaps why people decided to volunteer, why Ripon, just to help build up a bit of confidence at the start of the conversations. And we ended the chats as well by asking about any changes that might have happened in people's lives since volunteering. So, for example, a lot of people talked about some of the benefits of volunteering, which might include meeting new people, feeling better in themselves. And volunteers were also compensated for their time, so people received a £20 shopping voucher. And volunteers were given the choice as well. So in addition to the conversation, people could have the option of completing a diary. So the idea was that people had the option of recording a diary for 1 month. So that could be audio recorded or a written diary. And actually, we had most people opted for a conversation, but we did have 3 volunteers who opted to complete a written diary. And the idea of this was that, and I'll go along to talk about this in my reflections later, but that the researcher wasn't present during these diary entries. So, you know, thoughts and feelings and experiences could be written down without the researcher having influence, if you like, and being able to record in situ as well, as soon as you've received support or after different sessions. And again, people were compensated for this with a £20 voucher. And in addition to this, I also spent, it says 15 days, I think it was actually 10 sessions observing and understanding how support works in practice. And I'll go on again to elaborate on this later, but this really helped to understand the importance and influence of Ripon as a place and the importance of context as well. We're not reflecting so much on this particular method today, but just to give you an overview of all the methods that we've used. We thought I just mentioned briefly the outcomes questionnaires. So we have been completing questionnaires with new supported volunteers who receive support. And volunteers receive or complete 1 questionnaire when they first start volunteering, and then 1 in 6 months' time, with a quick catch-up in between at about 3 months. And we had aimed to complete this with 20 people, but because of various challenges such as staff leaving and things like that, I think we've got 5 at the moment, and hoping to collect a few more by the over the next couple of months. So again, people have the option of completing this over the phone, online, or in person. So that was with me, or people could self-complete if they wanted to as well. Most people have opted to complete it with me, either over the phone or in person. And it's probably taken about 30 to 45 minutes to complete. And again, people receive £20 shopping voucher to thank them for their time as well. So again, yeah, this is with new supported volunteers and 18 plus as well in terms of the eligibility criteria. So the questions asked are quite different from the conversation and diary, but we use kind of published measures, which people might be aware of. So measures that tended to use kind of Likert scales and tick box questions. And they covered like social connections, questions on loneliness and mental well-being as well. And we also asked some socio-demographic questions and questions around service use. So really the idea of these questionnaires is so we can look to see if there's been any changes and outcomes as a result of being supported to volunteer. So for example, that might be in mental health or well-being. And a really important aspect of the research was we put together an advisory group. So the advisory group had a range of different members who have, you know, different backgrounds and expertise. So we had 15 members in all. So the advisory group consists of even volunteers from Ripon Museum. So I think we've got 3 volunteers, which is fantastic. Researchers from York University and different universities across the UK. It also includes practitioners in the heritage sector, including Ripon Museum, and also from different organisations, including the National Academy for Social Prescribing. So I think the group we've met, or we're going to meet, 8 times over the course of the project. We've had all online meetings so far. And we meet really regularly to advise on the conduct and progress of the study. So really each aspect of the study, I would say, has been discussed and consulted with the advisory group. And volunteers, again, have paid for their time to attend the advisory group as well. So it's been a a really brilliant group, I would say, and it's just been such an incredibly important group and useful in terms of really offering advice at every stage of the study. So from things like ethics applications and documents through to outputs and the design and content of the manual as well. So we thought it was really important to gain, independent perspectives and a range of views that are external to the key research project team. So kind of acting as a critical friend to the research. And as I've touched on before, both the advisory group and the Ripon Museum staff who are part of the research team really help to de-researchify the research procedures for us as well. And yeah, just advising on every stage. This is just to give an overview in terms of the timeline and where we are at. So last year, from the January to March, that was when we put together the advisory group. We finalised kind of the outcome measures as well that we were going to use in the questionnaires, and as well as the topic guides. And during that period as well, we gained ethical approval. And then from March to December last year, this was when really we carried out most of the qualitative research. So we recruited participants, we collected and analysed the interview diary and observation data as well. And in order to analyse the qualitative data, we used NVivo, which I'm sure a lot of you are familiar with, to kind of organise into themes and codes. And from March last year, and then hopefully to the end of April this year, or it might go on a little bit longer, this is when we're recruiting the new supported volunteers and collecting the baseline data for the questionnaires, so the first questionnaire, and also a narrative economic analysis as well. And from September last year to October this year, that's when we're going to collect the follow-up data for the above. And then until the end of this year, this is when we're going to be putting together papers reporting on the evaluation findings, and the cost analysis will be drafted, and importantly, the intervention manual will be completed as well. And this is just some of the benefits and outcomes for people as well. So as I mentioned before, the volunteers are compensated in terms of gaining the £20 shopping voucher for completing the questionnaires or conversation or diary. And I suppose, they're making a real important contribution to a practice manual that's hopefully going to be useful for other organisations who might be thinking about delivering a similar supported volunteering scheme. We're going to be we've put together a theory of change, which I'll go on to talk about later in the presentation. And also, as Martin mentioned, a practice manual for supported volunteering, so that learning can be shared with other organisations. And that's going to be quite an interactive manual that's going to be have like online links and things. So it's quite exciting that we're getting to the stage of developing and producing and finalising that. In addition, we'll be publishing peer-reviewed papers, so that's both on the supported volunteering approach and perhaps on the reporting on the findings of the questionnaires, so in terms of the outcomes for supported volunteers. And we're also going to be presenting at different events and seminars like this one, and conferences as well. So just to move on to some of the reflections, some of the fieldwork reflections that I have in terms of the conversations and diary. Again, it was really recognised that potential participants might have quite negative feelings towards interviews. And I've said before, particularly if people have had negative experiences at work, or generally having like low mood or low confidence. So to reduce feelings of mistrust and any kind of potential anxiety, we took a lot of advice from the advisory group and research team, and we were referring, as I said before, to the interviews as conversations rather than, you know, more formal interviews as well, to encourage participation really. So that's in terms of providing a summary sheet about the research and in any information booklets. And also, again, just explain the research quite sensitively, so explaining that any experience and thoughts are really helpful for the research, and that there are no right or wrong answers, and just being careful to explain clearly about confidentiality as well. Again, we had a process, and Freya has been extremely helpful in approaching people for the questionnaires using this approach. But potential participants were approached first by Ripon Museum staff members. So they were able to give an overview of the study. And also when I carried out observations as well, which I'll go on to discuss, and I was able to build up trust with volunteers during that process. So I could then, you know, chat about the possibility of people completing a conversational diary. And again, in terms of the diary method, really the idea behind that was to enable people's thoughts and feelings and experiences to be recorded in situ, again, without a researcher filter, if you like, or interpretation. And people had the option of completing them, you know, as and when. You know, that it was entirely up to them how often they wanted to complete the diary, you know, even if they just wanted to reflect on one particular session. We also took advice from the advisory group and again research team, and we put together a diary guide. Excuse me. And within that guide, it helps you explain, you know, perhaps what people might want to record, including questions that might help when recording the diary entry. So, for example, you know, have you had any help from anyone today when volunteering? Who has helped? Some prompts about, you know, perhaps was it volunteers or staff members? How have they helped? And we just included a couple of examples from advice, taking advice from the advisory group as well, which helped to prompt people really. It was interesting that more people opted for a conversation and a chat with me rather than completing the diary entry, which is quite interesting to reflect on. We didn't know whether perhaps it was seen as extra work or, and as some people kind of needed quite a lot of reassurance about, you know, have I written enough? And again, just me saying, you know, there's no right or wrong answers as well. But it was good to give people that choice and over different options. As I said before, I also carried out some observations of practice at Ripon Museum. And I completed 10 kind of non-participatory observations in total. At Ripon Museum, they've recreated a workhouse garden, so I spent quite a lot of time there. And in terms of support in the garden, there's a staff member employed to manage the garden and volunteers, and there's also a support staff member who's employed in particular to work with supported volunteers. And I also carried out observations of the front of house where there's a duty officer, and they've got an office kind of behind the front desk, and they're on hand if, you know, volunteers need any assistance or any support with anything, and they're also available via phone. So it's all kind of, it's quite interesting the different levels of support that's offered. And I spent some time with the creation and learning team as well. And just to give a little bit more detail about what I recorded in terms of the observation. Again, this was through discussions with the advisory group and research team. We decided that it would be good to have some kind of loose structure around what I recorded when I carried out these observations. So we used this. This is the observation table that we used, and it was adapted from a tool that was used by a research team member. So things that I was looking for, and this, just to say, this was completed after the event. I didn't take any notes while I was actually at the museum. So I reflected on the particular activity or task that was taking place when I was down there, and I thought about the staff member, the supportive volunteer, and any other volunteers or staff members who were around. And I reflected on the conversations that were taking place and interactions. So who was speaking to who, what was said. And I thought about as well the behaviour that was happening, what were people doing, who's interacting. And again, touching on this sense of place and the context of what else was going on and who else was there. There was also room as well to add any additional observations, making comments about kind of the general atmosphere as well, my own reflections, and then just prompts and questions to ask staff members as well, which was quite useful in terms of, anything that needed clarifying in terms of the observation. So I found the sessions just really enjoyable, and particularly the garden, everyone was really welcoming. And although I said it was non-participatory, I did help out quite a bit, did quite a lot of gardening, I did some of the jobs that the volunteers were doing as well, rather than just standing back. And I think really through that process, I really got a sense of the importance of place and context as well, and how perhaps the culture of an organisation helps people to feel supported. I guess just through my own reflections and feelings of having been there as well. So it was a really important method. And just these bullet points, I think these were reflections within the advisory group as well. So people were asking, in terms of context, how does behaviour change in different contexts? So, for example, when volunteers are having a tea break or talking in the duty office, how is that different from, when they're carrying out a particular task? And again, that links to kind of the management of time and space, and the way sessions are organised as well. So perhaps the different areas people work in, where they have their breaks, etc. So they were really good reflections to think about after the advisory group. So just some additional reflections on the observations as well. Again, I think it would be quite difficult to fully understand the support without carrying out the observations. And I think as well, if you're coming into an organisation, it kind of shows that you care about the organisation you're researching, and really helps to fully understand the support that's available. And in particular, going back to that kind of supportive environment and that sense of place, if you like, that welcoming place. And I think they really offered a complement to the interviews and diary. And quite interestingly, it came up with different similar themes, if you like, and kind of nicely supported one another. And although it was non-participatory, and I was, in the background a lot, I was still able to ask questions and participate to some extent as well. And importantly, it helped me to find out the support, but also to help build up trust and working relationships with people, particularly people who I might approach about completing the conversation or diary. And perhaps just a reflection on, that I was engaged, and I wasn't, how neutral I was as well. I think I was reflecting on that the other day, and thinking about whether I had an impact as a researcher on the behavioural situation. And I think this was an earlier reflection on some of the earlier observations, whether I needed perhaps to focus more on the support was on offer, and sometimes there was a lot happening all at once. And again, notes were made after the visit. So I did have to remember kind of what was said and observed, So I tended to make those as soon as possible after I'd been to the museum. And these are just some reflections on the advisory group, and some of these comments I've probably reflected on already. But again, yeah, the stakeholders in the advisory group were really engaged with throughout the research process, and they were given the opportunities to advise on each stage of the study, if you like. And these are just some of the, there were lots of things people helped out with, but some important key points were that they helped to advise on the ethics documents. So I've mentioned before in terms of the interview questions or the conversation questions, being sensitive to the language that we used, and again within the information booklets and summary sheets as well. They helped to give advice on the observations, and in terms of the topic guides in the interview as well, they helped to ensure that we were being really understandable, and questions were asked very sensitively. And again, I think particularly the volunteers within the advisory group really helped us to understand the support and what was important from their perspective. And it was really good to be prompted that we were doing that throughout the research. Again, I said before, they advised on the observation methods as well. And what we tended to do before the advisory group was share any key documents with people, so people could be having a think about some of the issues prior to the meeting. Although, you know, we said you don't need to read these before the meetings if you didn't want to. But people also advised on the key themes that were emerging from the data. Currently, the advisory group is helping to advise on the manual outline, in particular the structure and the content as well. And also the theory of change diagram, which I shall go on to talk about in a moment, which has informed the structure of the manual. Yeah, so the advisory group were also involved in a theory of change workshop recently. And I don't know, you may or may not have heard of the theory of change before, but the aim really was to produce a theory of change diagram. And within the workshop, we were really exploring, these are kind of the key things that you would explore in a theory of change workshop, why support is important. So in this case, in particular, why is support important for particular volunteers to enable them to volunteer effectively, if you like? Who is it for? In this case, supported volunteers. You know, who are the supported volunteers? And really unpicking how the approach and model of support works as well. And also, importantly, looking at what the benefits are for people who are receiving support. And as well, thinking about linkages. How does the support link to benefits for people who are receiving support? So just to provide a bit of information about the actual structure of the theory of change workshop. So all members of the advisory group were invited to the online workshop. And we used Jamboard. We split into two groups, and we used Jamboard as a method, which I hadn't used before, but it's a really helpful method. It's like kind of a digital whiteboard where you can put post-it notes on. So it was a really useful method. And in session 1, so we had like 3 sessions within the workshop. So the first session explored what the support looks like. So really unpicking the key aspects of support, who supports the volunteers, how often, how should the staff member approach the support, and how should volunteers importantly experience the support as well. And if you read about the theory of change, sometimes it is quite jargonistic, so we try to get rid of some of the jargon. So for example, some of the literature talks about mechanisms for change. So we changed that, you know, in terms of, you know, what does this support look like? Again, in session 2, we looked at the changes and benefits for people, so particularly exploring what the benefits and changes that can happen as a result of people being supported to volunteer. And really thinking about changes for the volunteers receiving support, but also other volunteers, staff of the organisation as well. And the third session explored perhaps what helps and what gets in the way, which is referred to barriers and enabling factors. Again, thinking about kind of accessible language as well. So yeah, so hopefully the session was inclusive for everybody. We did a little practice round first, and we had researchers in each group, if you like, to kind of lead the sessions, and help to write down any comments if people were having any difficulties using the Jamboard programme. And again, information was sent prior to the workshop. And we hopefully created quite a supportive and encouraging atmosphere within the session. And this was just what was produced after or during the Theory of Change workshop. So we had these are all contributing comments to what is supported volunteering and unpicking the particular approach. The blue comments here are all around like changes or benefits, and this at the bottom is kind of things that get in the way, barriers, things that help, and this was around like the importance of setting and place as well. So what we did, this importantly, what emerged from this session was the Theory of Change diagram, which Martin's going to discuss next, I think. And together with the findings from the qualitative data. And I think this together with the data really helped to strengthen the findings, and it helped to identify any gaps, I think. And it also helped us to kind of organise some of our thoughts into various subheadings as well. And people were also invited to, you see some of the arrows, to think about the links between some of the themes as well. So I think Martin's going to talk about this slide next.
I'm not going to say a lot because there's an awful lot here, but this is forming the structure for the practice manual for the guidance on supported volunteering, and it forms a very traditional pattern where you've got outcomes on the right, inputs on the left, and the bit in the middle is what's kind of happening. If you were to mix a cake together, then that's the mixing process in the middle, I guess. Enabling factors and barriers run along the bottom, and we felt that they could come in at any point in the process. This is really another presentation, but I think the key thing to think about in terms of methods and our focus on making the methods more amenable to people is that we feel that we've had an authentic engagement from volunteers and staff at the museums, that we feel that the data we've got has been comprehensive as a result of that. It's very difficult to know if we had done something different whether we would have found something different, but I feel that we've been able to at least get to the heart of what the support looks like. And one of the main things is that it's organizational as well as at the individual level. It's about the context and about the nature of the organization. We know that wellbeing gains come through heritage organisations just engaging with them anyway, and through volunteering, but it's the mix that's probably happening here which is having a benefit. I'm aware that we do need to allow some time for discussion, so I'll very briefly go on to the last point. And really, just to sum up what we've said here, it's about that mixture of both the place where this is happening and the individual and group support that's happening. The triangulation has been helpful in terms of using data from the different methods and piecing them together and seeing how they're saying different and similar things. That's all been very helpful. But what we aim to be the outcome of this is that the theory of change can be taken and used by other organisations. And I guess that's the next study, is to see whether it makes sense elsewhere, if it's too context dependent, or indeed whether it can be used to set up a similar scheme elsewhere. Now, we've gone way over our 20 minutes, but we're very kind of enthusiastic and keen to say an awful lot, but hopefully there's enough time still for some discussion at the end. Thank you very much.
Thank you so much.